Welcome to today's episode of Lifestyle Matters. And once again, I'm joined by Fergal Armstrong for today's episode. Welcome, Fergal.
Hiya, Sabina. How are you?
Okay, so I thought today we might talk a little bit about social relationships and loneliness and isolation. It's a very apt time to talk about it, but I think it's something that's been brewing, you know, for a very long time. It's just getting more recognition in recent times, given the whole world is going through a pandemic. But that's not to say that this has not been a problem for many, many years, going unrecognized. Some even say that loneliness is equals, it's as important as looking at smoking or obesity, a risk factor for heart disease. So, Fergal, let's start off by talking about what social relationships are and how would we define social relationships?
Yeah, just to pick up on that point that you said about loneliness being as an important a risk factor for heart health as smoking, it just highlights the phrase, how many times have we heard in literature and culture someone dying of a broken heart? It is possible to die of a broken heart. It is possible to be so sad that it contributes to your mortality.
Takasubo.
What are social relationships? Well, I suppose it's easy to define what they're not. They're not Facebook friends. Relationships in social media, and in fact, the use of social media is actually proven to be harmful. And the relationships that we form within social media are not validating healthy relationships that we need as human beings to actually thrive in society. We need real live relationships. And I suppose that goes to, the experiences of when we were cavemen, because our lives, our very survival depended on us being part of a social group, a group that was bigger than the sum of its parts, and a group that was able to actually defend itself. And when we talk about being ostracized, we talk about being ejected from a social group. Back in those times, that really was nigh onto a death sentence, because our chances of surviving on our own outside the social group, in the jungle, for instance, those chances of survival were minimal. So being ostracized was a source of existential pain that continues to this day. So again, we suffer from loneliness when we are ostracized, when we are removed from our social group. And that pain is as bad as physical pain. And for certain people, it's worse than physical pain.
Yeah. And I guess I just wanted to just pick up on that a little bit. Like, you made very important points there. The first thing, the social media use, which we would dive into in a bit. But the other thing about isolation and loneliness, and I thought it might be a good time for me just to sort of, explain about what the differences are between social isolation and loneliness. We are all now very familiar with the term of isolation and social, isolating yourselves when you're unwell and things like that. But, isolation is basically when you are actually reduced, you've got a reduced social network. You are actually away from everyone else physically. But when you're isolated, there is a chance that you may not necessarily feel lonely. And that comes down to your personality types also. But loneliness itself is actually a subjective feeling of feeling lonely. So you could be very well surrounded by hundreds of people in a crowd of, all your friends, but you could still feel lonely. And I think that's what we're trying to hone into, that feeling of loneliness is what they find has been associated with a lot of diseases, And
you use the word personality types. I mean, there are certain personality types that actually avoid, sorry, I don't want to use the word avoid for reasons which will become very quickly apparent. There are certain personality types that just don't want to be social. An example of that personality type would be the schizoid personality type, where they do not seek relationships and they are perfectly content on their own. And they are the kind of people who really do thrive on their own and don't feel the need for relationships.
Yeah.
There is another personality type, which is called the avoidant personality type, where they fear rejection. And so that's why they don't actually seek social connection. But the fear of rejection keeps them away from people, and they're also lonely. Or rather, they are isolated, but they're very lonely because they crave the one thing that they cannot have for fear of that rejection. So personality types do play a part in one's response to isolation, which, as you say, can either engender feelings of loneliness or not, as the case may be.
Yeah, and just on that personality types, there is actually a quite a famous personality test that people do in workplaces and things called the Jung's personality test. Not
Yeah.
sure if you're familiar with that, but I think it's a great test to do. I do it from time to time. It's interesting. I did it about 5 years ago actually 10 years ago now when I started internship,
So
and
what's
then
your
I do it
personality
now.
type then, Savina?
Well, should I be saying that out loud? But well, you know what? It actually fits what I am. Well, definitely not an introverted, but let's not go into that.
Yeah.
But I think it's a good
But
test to
again,
do. It gives you an insight about how you are
yeah,
and how you function and
yeah,
what traits you have that make you work well as a team player, or are you better off doing work by yourself? And I think it's a good
yeah,
test to do.
yeah.
You're going to say
I think
sorry?
it's also important to understand exactly what the definition of introversion and extroversion are, because I'm personally an introvert. And some people say, well, how can you possibly be an introvert? And I said, well, it's because I don't feel energized when I am around a lot of people. Whereas extroverts feel energized when they are the center of attention and they're around a lot of people. I don't actually feel energized. So it's not about whether or not you can cope with being in a group, or whether or not you can cope with having attention put upon yourself. It's not about coping with it. It's about whether or not you feel energized in response to that stimulus. And
And it's
so it's
interesting you mentioned that. Sorry,
God,
just quickly because of that. Just it comes down to exercise, and I think you just putting it into perspective. You enjoy exercising by yourself, I think,
yes,
and
I do.
yeah, and I enjoy exercising in a group setting. Like I go for classes because I find I'm
Yeah,
more energized when I'm actually exercising with others. So it's interesting that
yes,
you put that, and you can extrapolate that into exercise. Um,
yes,
yeah,
yes.
sorry, yeah.
So I suppose the bottom line message is that, like, everyone's different. There's no right or wrong.
Mm-hmm.
And there is a difference between being isolated and feeling lonely.
Yeah, and I think it
So
just comes down to
Savina,
the fact that we are all, as you pointed out at the start, that we're all humans. We all crave social connections to some level. The question is
yeah,
at what level and how much we actually, when our demands for these social connections are not met, that's when we actually end up feeling lonely.
exactly, that imbalance. Yes, but
Yeah,
basically, I suppose another way of thinking about it then is what you're saying is that loneliness is really an unmet need for social connection.
yeah, yeah. And
Yeah,
that comes down to when you mentioned social media use.
yeah,
And they've found, especially in the recent times, there's been a lot of social media use. There's been a huge spike in it, but at the same time, there's a huge spike in mental health. And one, starts wondering, why is the case? Are you not getting your social needs met through social media?
yeah.
Take us through that, Fergal. Why is
Well,
social media use? Um,
I think that there's empirical evidence that it actually creates anxiety and depression.
mm,
And I think it also creates this sense of keeping up with the neighbors, keeping up with the Joneses. I mean, I've got patients who talk about the fact that they feel inadequate because they don't have the same kind of Facebook lives that their friends do. And I have to say to them, well, those very same friends of whose Facebook life that you are jealous, they're also coming to see me because they're equally as miserable. So there is this competitivenveness on the one hand, and on the other hand, there is an absolute vacuous value. There's no value in these relationships. Having 3,000 Facebook friends is not in any way meaningful to you as an individual. If you actually look at small tribal villages, you have basically an inner circle of friends and an intermediate circle of friends. And really, your inner circle of friends is maybe 3, 4, 5 people, and that's it. And those are the people that you share secrets with, and those are the people that you bare your soul to. And then they're the kind of the people that you function with throughout your daily life, and that's about the size of a small village, 20 people. So these are the real people that you need to be working with and you need to be valuing. And so, it takes a village to raise a child. It takes a village to be happy, I think. And, we're talking about 20 real life people and maybe 2, 3, 4, 5 very, very close friends. Now, how do you define close friends in the modern world? Well, I say someone you can tell a secret to and someone you can borrow money from. I don't know. How do you define close friends?
um, God, how do I define close friends? I don't know, Fergal. Someone I would
Oh,
be
by the way,
being in
Savina,
contact with.
can I borrow $50? I think you're a close friend of mine.
Now, let's not go around doing that, huh? What if I don't have the
Oh, so
financial
I'm not a close
means?
friend then.
Well, what if I don't have the financial means to do that for you? Then
Well, then you'd
how?
be able to
What?
tell me.
That is true. Then I'll be open enough to tell you about it. So yeah, that is true.
Yeah,
Actually, that is a very good way of defining what a close friend is, because I would be comfortable to
yeah,
tell you that, my situation, my plight, that I might not be able to lend you
yeah,
some money. But it's
yeah,
someone, social close friends are people I trust and the ones that I keep regular contact with. And that's basically
yeah,
what close friends are to me. Yeah. And there was sometimes you actually find that people who, this is what we've actually found, that sometimes people who actually post everything on social media, there is something else that they're sort of trying to hide behind, like
mm,
putting up a facade, trying to hide their
yes,
loneliness. They found there is people who've actually have used social media quite heavily, have a 20% increased risk of feeling lonely compared to people who use it very in a light use.
yeah.
So, that's
So that's the
telling.
empirical evidence I was talking about. The more you use social media, the more depressed you are. Now, there's not a causal relationship yet, but it is definitely an association, which I think is good
Yeah.
enough for me.
Yeah.
Yeah.
So, what other risk factors are there in terms of for developing loneliness? I mean, social media is clearly one of them. Would you take us
Yeah.
through the other risk factors for?
Well, you have to think about, the personality types as we've already found. We have to think
Mhm.
about social skills. We have to think about developmental criteria. We have to think about, adverse childhood experiences and that leads to low self-esteem and feelings of inadequacy and the idea that, you're not good enough, you don't feel valued, you're not valued enough to be sociable with someone else, and the fear of rejection, which then goes back into personality types. We also have to think about occupation. We have to think about, external circumstances that limit our social realm and our social network. And again, the more pressing issue about, enforced social isolation with the current epidemic of COVID. Before we dive into any of these risk factors, do you have any other risk factors?
Well, I guess the other things I would talk about is also people from different ethnicities, cultural groups, poor
Yeah.
communication skills, language, a
Yes.
barrier.
Yeah.
So
Yeah.
migrants, people
Yes.
who, as I alluded to just now, if I didn't have $50 to lend you, financial strains that might be preventing me from, socializing, because the people that I hang out with have far more money to
Yeah.
do things and I
Yeah.
don't have enough of those things. The other group I would talk about would be, groups that have, I guess, at a bit of a disadvantage because of discrimination. So, the LGBTQI community sometimes, but that's getting a lot better these
Yeah.
days.
Yeah.
People who have a physical disorder, like, someone who's wheelchair bound or,
Yeah.
any sort of disability, they can also feel a bit
Yeah.
isolated and
So these
avoid
are all
social.
groups that are in some way disenfranchised.
Hmm.
People who are traumatized, people who are immigrants, people who are, LGBTIQ, people who are disabled. They're all in some way, or they all have been in the past in some way disenfranchised. So
Yeah.
I've often wondered, what is it about connectivity, personal connectivity between two people? And I've wondered what are the mechanics of dealing with the risks or the fear of rejection. And I think a big issue is perceived inequality. I think if there's a perception of an imbalance in power or inequality, I think that leads to difficulties in making relationships. Whereas if there is the perception of sameness or equality, well, then that facilitates relationships. And I suppose one of the famous sayings that we all have heard, one of the proverbs that we know, is that birds of a feather stick together. And, that's true. We do tend to make more connections or more easy connections with people that we identify as similar to ourselves rather than different. So being different in whatever way, shape, or form that might be can be an impediment and or a risk factor to establishing social relationships, and can be a
I
risk
can
factor
vouch
for
for that,
becoming
actually,
lonely.
Fergal.
Yeah.
This is obviously a very, very, just drawing a very distant relationship to what you've just said. But, doctors tend to be said, they always tend to sort of stick together and sort of, socialize with them. At least that's what I've been blamed for. And when I try mixing around with my husband's friends who are not doctors, I do sometimes feel a little bit lonely because, we all feel loneliness from time to time, and that's normal. So when I could be surrounded by different people, but everyone there has got a different sort of way of thinking and different interests, and I could feel a bit different and I feel that imbalance in our social relationships just because of that difference. So it's interesting that you say
Yeah.
that power imbalance, just differences, can make you feel lonely.
Yeah, and I also reflect on the medical world and the socialization within the medical world. I think doctors and nurses and allied health professionals are so focused on healthcare to the exclusion of everything else. That's number one. And number two is there is automatically a group of people with whom you automatically bond. So for those two reasons, I think anyone working in healthcare does find it more difficult than everyone else to make connections, because nobody else, I don't think there's any other profession where there is automatically such common ground,
Yeah.
So it's so easy. And so everyone else really has got to do that, has got to make relatively a little bit more effort all the time to make social connection.
And I guess it's also because people are generally people who are non-healthcare. They are more interested in what is happening in the healthcare world because it is about their body, it's about their own health. So it's something that every single person can resonate with. So yeah.
Yeah.
So I guess in terms of risk factors, is there anything else you'd like to add before we move on?
No, I think we've pretty much covered it. Just to reiterate, I think that any factor in your life that makes you perceive yourself as different to others, I think can be an impediment. And I want to reemphasize the idea of adverse childhood experiences really knocking your resilience and your self-confidence to make that, to reach out to people for the fear of rejection. I think that's an under-recognized group of people because you can't tell if someone's had an adverse childhood event, but you can tell if someone is of a different ethnicity or is disabled or speaks a different language or things like that.
That is very true. And I think the other important point to make is really that we all will feel lonely from time to time. It's just how we go about getting help will be one of the important factors to not be stuck in that loneliness sort of world.
Sure.
I mean, there are lots of, I guess, a lot of research being done in terms of why loneliness is such an important thing, how it affects us mentally, medically, in terms of, obesity and diabetes and inflammatory conditions and things like that. And I think we will get into that in the next episode.
Sure.
I think that is all we have time for today, Fergal. Thanks for joining me in today's episode. All right, that's all we have time for today. Thanks for watching. We'll see you next time.